Hi, I am Ashley Hansen, and I will be talking about same-sex attracted for my vulnerable population presentation. So same-sex attracted, just a little bit of an introduction to this population. It is romantic attraction, sexual attraction, or sexual behavior between members of the same sex or gender. Um, a few terms that may be used throughout this. LGBT stands for lesbian, gay, bisexual, and transgender. Let's become familiar with some of the terms used within this population. Lesbian is homosexual woman, gay, homosexual man or woman, bisexual, person who is attracted to both genders, transgender, person who identifies his gender as different from their biological one, and queer is a synonym for gay. Why are same-sex attracted individuals a vulnerable population? Overall, we'll hit a lot of the reasons why this is the case, but why they are part of the vulnerable population. But a lot of it has to do with mental health. Um, so we will hit on a lot of that as we continue on. Size of the population. So unfortunately, this information was kind of hard to obtain. They do not ask about this when they put out any survey or when they do the census. So locally, I was unable to obtain this information due to no surveys being put out, but the information that I did obtain is from the Gallup survey data. What I got is that statewide, 4.7% of individuals who live in Utah are part of the same-sex attracted community. This is pretty high. This is the seventh highest. Utah's the seventh highest state in the U.S., which is surprising to some. Utah is a very conservative state, so I don't know. As I read, a lot of people are surprised by that, but the governor and many community members have shown support in many ways to the LGBT community. Utah's been very proactive and progressive with moving forward with LGBTQ rights. So that's been good, and it has encouraged a lot of people who are part of that community to move to Utah. Nationally, percentage who are part of this community is 3.6%, and internationally it's about 3%. Social determinants of health. First, let's talk about what are social determinants of health. It's simply what makes some people healthy and others unhealthy. How can we create a society in which everyone has a chance to live a long, healthy life? Which is ultimately the goal. So, some social determinants of health in same-sex attracted population. The first one, social support. This one's being the number one. A lot of people in this population feel rejected by many people in society. The second one, social norms and attitudes. A lot of people in this population are discriminated against and commonly have a lot of distrust in the government systems. They feel they are against them and what they believe in. Specific concerns for this population. Like I mentioned before, mental health. That is a huge concern, probably number one. There's very high rate of psychiatric disorders, high rate of substance abuse. Suicide rates are very high, 2 to 3 times more likely to attempt suicide than those who are not in this population. High rate of communicable diseases, HIV and STIs are a major concern, which we will talk about this a little bit more. Bullying, drug use, healthcare access, and more likely to be homeless. The root causes of, so basically, why is this group of people a vulnerable population? So it's due to many healthcare disparities, including high risk for substance abuse, anxiety, depression, suicide, STDs, and bullying. So all of these are compared to the general population. And one thing that I would like to add is it's not necessarily is everyone in this population going, and this is with any vulnerable population. Not everyone in this population is vulnerable, it's just a population as a whole. And not everyone in this population is going to experience these issues that we're talking about. So it's just an overall, and it is compared to the general population. Maslow hierarchy of needs. So this population, same-sex attracted, according to the research that I've done, as a whole, the population does not have all of the needs met. So it looks like they only got to the psychological. So a little bit more on that, why the other ones are not met. So safety, from name calling and bullying to being denied jobs and healthcare services, many individuals in this population do not feel safe. Love and belonging, not accepted by friends and family, not accepted at work by coworkers, not getting a job. It is harder to find a partner due to how small the population is of those who are also of the same sex attracted. Esteem, respect is not always given from others. Self-confidence can be lacking. Self-esteem can be low. Self-actualization. It is not common for those in this population to make it to this high in the hierarchy of needs. It is the goal for everyone to accomplish this, but unfortunately it's hard to get here with so many barriers in the way. With that being said, it is possible. Communicable diseases and infections. This population is at high risk for many communicable diseases and infections. STDs are on the rise in this population. Men who have had sex with men account for 83% of syphilis cases. Many other STDs, including chlamydia, gonorrhea, and HPV, are common infections spread throughout this population. HIV is commonly a communicable disease spread from man to man who have had sexual contact. What can be done to decrease the transmission? STDs are spread through sexual contact without a condom with someone who has an STD. Sexual contact includes oral, anal, and vaginal sex, as well as genital skin-to-skin contact. Some STDs like HIV, chlamydia, and gonorrhea are spread through body fluids such as semen. Other STDs, including HIV and Hep B, are also spread through blood. The transmission can be decreased by educating those in the population on how to prevent the spread of the diseases and infections. Those who've had more than one sexual partner should be tested for STDs often. The CDC recommends sexually active individuals in the LGBT population get tested for HIV, syphilis, Hep B, Hep C, chlamydia, and gonorrhea. Back to HIV, CDC recommends that sexually active individuals get tested every 3 months, at least once a year. Those who are having casual sex every 3 months. It is also important that we educate on appropriate vaccines that are given to help prevent the spread of these STDs. Non-communicable diseases or infections. Studies show that mental health and substance use is increased in men who have had sex with men and women who've had sex with women. Also, it shows that suicide risks or suicide attempts are increased in this population compared to the heterosexual population. Depression is one of the most common. Mental illness is increased in this population. Anxiety disorders are increased. Substance and alcohol abuse are 1 times more common in this population. It is found that the odds for substance use among this population is 190% higher than those of heterosexual youth. These diseases can be managed with the help of a professional. It is important to be aware of those in the population and encourage them to reach out for help. Medication and counseling can help manage these symptoms. Self-care/self-harm. Lesbian, gay, bisexual, and transgender youth are particularly at risk for self-harm. Suicide, especially being the 3rd leading cause of death among adolescents and those in the LGBT community, contribute to these stats quite a bit. Victimization, low social support, hopelessness, and impulsivity were all associated with increased risk of self-harm and suicide attempts. Youth are not only the ones at risk for self-harm, adults in the population also have higher risk of suicide attempts. An important thing as healthcare providers, we can know that health centers can make a big difference in LGBT patients' lives by training providers to screen and assess to address suicidal ideation. Providers can enhance social support and self-acceptance. Things to look for when people say life is too difficult, wanting to be dead, thoughts of ending own life. It is important to refer patients to the appropriate help that they need. Concerns, risk for harm for themselves or others. Violence is a very visible health concern among those of the same sex. So physical assault, 28%, and sexual assault, 27%. This is a global review. Intimate partner violence is very high in male and female partnerships. National Domestic Violence Hotline, this is a resource that can be used, and anybody in this population should know about it. Violence against those in this population can range from bullying in school to workplace harassment to physical violence. Youth in this population face serious problems with bullying and harassment in school. Supportive school faculty and presence of school clubs which support their beliefs and things that can help these children get through these difficult times. Those are things that can help them get through these difficult times. And here are the references.